what are we going to do in terms of the webinar today? Three main aims really in terms of the overview. We want to explore the types of feedback you could collect, and also the methods for obtaining patient feedback. So we're going to have a look at a number of different methods and templates that you can use to collect patient feedback in your practices. We also want you to consider what's important to your particular practice in terms of patient feedback. So what matters to you? What do you want to record in terms of patient feedback? So specifically think about what's going to work for you in your practice. We're also going to explore how patient feedback can inform your practice, so how it can enhance your practice and what you can learn from doing that as part of your CPD. So that's our overview. Before we go on to looking specifically at patient feedback, I thought it might be useful to look at the aims of the CPD scheme and where patient feedback actually sits within the CPD scheme, just to give some context. So I think it might be helpful. So in terms of the main aims of the CPD scheme in its entirety, there are three key aims, and they're largely around engagement, support, and community. So what we want you to be able to do is to be able to engage with the scheme, get the professional and personal support that you need, and also be able to build and develop networks and communities within the profession. So that's the ultimate aim. And we know from talking to osteopaths that you like to talk shop, and a big part of the CPD scheme is doing exactly that. So you'll be very familiar with the large majority of it. We also want you to be able to enhance your practice and support practice in accordance with the osteopathic practice standards. And we hope that the scheme will help to reduce any fears about professional isolation, and also hopefully increase your confidence to share your CPD and practice with others as part of the community within the profession. So in terms of the CPD requirements, we have three main points there on the screen. You need to undertake a minimum of 90 hours across that 3-year cycle, and at least 45 hours of those need to be learning with others hours. And then towards the end of the 3-year cycle, we're asking you to complete a peer discussion review. And some of you may be aware we already have a video on the peer discussion review, which takes you through that in more detail. For those of you that haven't seen that yet, you may want to look at that after the session as well. So let's have a look at the CPD scheme requirements. So there are 4 main scheme requirements. The first is around the range of practice, and what we expect you to do there is undertake CPD, undertake CPD across the 4 themes of the osteopathic practice standards, and that includes theme A, which is communication and patient partnership, theme B, which is knowledge, skills and performance, theme C, which is safety and quality in practice, and theme D, which is professionalism. So that's around range of practice. The second standard is objective activity, and this is what we're focusing on today. So you need to do at least one activity of the following. So one of them is patient feedback, which is what we're going to do today. One of them is PROMs, which is patient reported outcome measures, and we're going to have a little look at that as well, because that's a form of patient feedback. Peer observation, clinical audit, or case-based discussion. So you only need to do one of these objective activities to complete that part of the scheme. So doing these 2 sessions on patient feedback will allow you to complete your objective activity. And we'll show you how you'll be able to demonstrate how this has influenced your CPD or practice as a result as well through these 2 sessions. The third standard of the CPD scheme is around communication and consent, and that's we're asking osteopaths to do every 3 years to undertake a CPD activity in communication and consent as part of the new requirements. And the 4th standard is around maintaining a record, a CPD record, so documenting the evidence. So many of you will be familiar with doing that from the previous scheme as well. And at the bottom of this slide, you can see that towards the end of the 3-year cycle, we're asking people to complete a peer discussion review in accordance with the CPD requirements. And that's in relation to these 4 jigsaw pieces that you can see here. And as I say, we have some supplementary resources and a video that you can watch around that if people want to follow that up. So we're going to go to our first poll of the webinar series in terms of, have you undertaken an objective activity other than patient feedback, just so we can get a sense of where the group are in terms of their objective activity. So the poll is now open. For people to put their responses through. So I'm just going to give it a few moments to make sure everyone's able to respond to the poll. Now, hopefully everyone's had a chance to respond to the poll, and the slides have come back to you on your screen, where you should see stages of patient feedback that we're going to have a look at. We're going to have a look at the results of the poll towards the end of the session, so we'll let you know where everyone's responses were in relation to that. So in terms of stages of patient feedback, there are 4 key stages that primarily around patient feedback, and this webinar is going to look at pretty much stages 1 to 3, and stages 4 we'll look at in the second session. So stage 1 is around the development or selection of questions, so deciding on the questions that you're going to ask your patients, and develop that into some form of perhaps questionnaire or survey. The second stage is around planning and administration of those questions. So thinking about how you're going to tell your patients what you're doing. So providing them with an information sheet, detailing why you're doing what you're doing and what it's for. Thinking about the administration of how you're going to collect that data. So thinking about whether perhaps you might have a hard copy or online survey, for example, or something else. Or also thinking about your sample selection. So who are you going to ask to complete your survey? And by that we mean, you know, are you only going to focus on new patients? Are you only going to focus on returning patients? Or maybe it might be both. You might concentrate on new and returning patients. And also thinking about administration. So do you need to involve anyone else in that planning? So if you work in a large practice, are you going to get your other colleagues to work with you on this, or your associates, for example? Or is there a need for you to involve your receptionist, for example, something like that? So thinking about who else you need to involve in the process. Stage 3 is around dissemination, so disseminating those questionnaires to your patients, whether that be online or hard copy, so actually giving them out to patients. And as I said, the final stage is around analysis, which primarily the second session will focus on. So, you know, what do you do with the information that you get back from your patients? Next steps, and how can you make it work in terms of development and key areas to kind of enhance your practice, and developing an action plan. So that's stage 4 we will focus on in our next session. So thinking about your practice, what we want you to think about is what area of your practice are you interested in exploring with your patients, and why? So these are all questions to consider. What questions should you select? So when you're thinking about, you know, what type of questionnaire or questions am I going to select, you need to think about particular areas of practice. Do you want to focus on, for example, obtaining patient experiences, so their experience of your practice or clinic? Or are you interested in patient satisfaction, so how satisfied are they with the treatment they've received, for example? Or are you more interested in patient outcomes, so, you know, how quickly perhaps patients improve as a consequence of having osteopathic treatment? Or perhaps it's some other area of practice that you're interested in. So these are just some options to think about. Also, we have a number of templates that we're going to have a look at shortly. So bear in mind, you know, what templates could help you do this, and which templates you'd like to use. So have a think as we're going through the session, which might apply to your practice the best. So just to kind of recap, think about the methods, the content and quality that you need to think about in terms of your own practice. So for many of you, you're probably, in terms of methods, you're probably already obtaining quite a bit of verbal feedback on the day, but this session is trying to kind of make that that feedback that you receive more formal and perhaps more structured by perhaps using a questionnaire template, for example. For some of you, perhaps with larger practices, you might want to consider later down the line, perhaps a focus group activity, for example, might be an option. Content-wise, you need to be thinking about, do you want to collect satisfaction or experience-based responses from your patients, or are you more interested in outcome-based responses, which we'll have a look in a little bit more detail through the NCOR video, hopefully. Or you might be interested in preparedness for consultation. You know, how prepared is your patient for perhaps their first consultation with an osteopath, for example, or it might be something else. So thinking about that content is really important. The third sort of element is the quality. So how can you get the best quality feedback? You need to think about how best you can ensure that patients completing the survey remain anonymous. You also need to think about whether you want to give out your patient feedback surveys perhaps on the day of the consultation, or perhaps afterwards, for example, following up with the patient afterwards. So thinking about what suits your patients best and how you can ensure the quality of feedback is enhanced. And also thinking about how to encourage response rates. So what can you do that would help you get the best response rate you possibly can? So thinking about things in relation to those patient feedback methods, what methods could you use to collect feedback from your patients, and thinking about the advantages and disadvantages of those. So we're going to have a look at some of those in relation to the most prominent two kind of types of survey that you'll probably use. Some of you will choose to do it online, and some of you will choose to do a hard copy survey, I'm sure. So we're going to have a look at some of the advantages and disadvantages of doing that to help you make that decision, really. So just to give you a flavour, some of the sort of advantages and disadvantages of using a hard copy questionnaire, so that you would hand to your patients to complete. Primarily, resources show that it's pretty easy to analyse paper questionnaire. It's quite easy to make it anonymous as well. And the large majority of you will have the tools in place to kind of put this into practice pretty quickly, which will be an advantage. Often people report feeling much more comfortable and honest if they're not speaking directly to a clinician to complete the survey, so that's an advantage as well. It's going to be it's not going to be very expensive to do either, as well, and you should get high numbers of feedback with a hard copy questionnaire. Some of the disadvantages, it may not go deep enough. You know, you might only just sort of reach the surface in terms of some of the comments that are made. It may not cover sort of sensitive issues as well as some of the other types of research methods. Other things are that non-response rate or selection bias perhaps could exclude certain groups. You know, perhaps it won't suit certain groups, a hard copy questionnaire, for example, and could exclude key personnel such as carers, for example. And often with close-ended questions, you may be more likely to get positive feedback because it's a kind of close-ended tick box scenario. People more tempted to perhaps tick the positive end of those scales, for example. In terms of looking at online questionnaires, so for those of you that might want to do it, to send a link to your patients to your survey, some of the advantages of doing that is that you can gain unprompted feedback from a large number of people quite quickly. It gives you an indication of what respondents feel most passionate about in terms of your practice. You probably get quite a range of ratings from an online questionnaire, and you may be able to correlate your findings with other measures of patient experience. So some of the templates that we will look at, and particularly the PROMs, will allow you to actually compare how you're doing in relation to perhaps the wider profession, for example. So it does give you that option. Disadvantages include things like only certain types of people may comment online, so it might not capture your whole client base if that's what you want to do. you may only cover sort of selected components of the patient experience, so it might not cover everything that you particularly want. And sometimes it might be seen as by respondents as a bit simplistic in terms of the rating scales, for example, and you might not capture every key issue that you might want to. Similarly, they're also with online questionnaires prone to a bit more negative feedback because of the distance between your patient on an online survey and you as the clinician. So you might get more negative feedback via an online questionnaire. That's possibilities anyway. So it gives you an idea of some of the advantages and disadvantages, and hopefully helps you to kind of decide which might be suitable to your practice. And it really is up to you and what matters to, you know, what suits your client base best. So have a think about which would be most appropriate for you. For those of you that are thinking about using online platforms, this is just to flag the possibility of a free online account for SurveyMonkey. Some of you may be familiar with that package, but if you sign up for a free account, you could potentially, when we look at some of the templates, you could potentially copy those templates into your free online account, and it will give you a link for you to be able to send that to your patients. But just to flag that there are some sort of terms and conditions to a free account, because I don't want people to pay for things that they don't need to. Limitations with the free account are that you can only have 10 questions in your survey, and it will collect up to 40 responses. If you collect above 40 responses, it will want to charge you a fee for, you know, for a paid account. So just have a, if you're thinking along the lines of doing it online, please look at the terms and conditions for the SurveyMonkey and see what best suits you in relation to what you want to collect. But that's a possibility if people want to put their survey into an online package. Other methods of feedback that people might consider. Many of you are probably already collecting some form of verbal feedback, patient feedback, and you might want to think about ways of perhaps recording that feedback that you receive from patients. So you've got some case studies, for example, and perhaps recording specific feedback received during a patient consultation, and then recording and reflecting on it for purposes of CPD. So that's another option for some of you that want to do a much more smaller scale or perhaps in-depth patient feedback approach. For those of you that have got perhaps larger practices or multidisciplinary practices, at some point you might want to look at sort of focus groups as a possibility. So getting a group of patients to volunteer to share their experiences of your practice, and this could focus on, you know, key areas that you're interested in as a practice. And focus groups are often facilitated by an independent person to give that kind of independence to the group as well. So you might want to think about a facilitator if you want to go down that route. So just to advertise, you know, flag that there are other options than just the survey if that's not what you want to do. So we're going to go to our second poll, if we may, which asks you, which method of patient feedback are you going to use? So the options are hard copy questionnaire, online questionnaire, other method of feedback, and not yet decided. And it's okay if you haven't decided yet. It's just for us to get a picture of the group that we have here today in terms of your thinking. So the poll should now be open. So just give you a few moments to respond to that. Right, and the poll should have closed now, so I'm going to just move to the next section, which is going to have a look at the current templates that we hold, that you could potentially run with as they are, or you could adapt them to suit your practice, or you could mix and match the different templates that we show to suit your needs. So I'm going to show you 5 templates that potentially you could use in your practice. So the first 2 are very much concentrated on the current context context and environment that we find ourselves in relation to COVID-19, and looking at the impact that has had on patients' experience. So we have one of template to look at in relation to that, and the second one is developed by the National Voices report, what we need to know. So we're going to have a look at both those templates to start with. So this is the impact of COVID-19 template, and you'll be sent all of these templates after the session with the follow-up email. So please don't worry if you don't need to scribble everything down in terms of this. You will receive these afterwards. So this template primarily looks at 3 different sections, and you might want to take bits and pieces out of this template, or just run with a particular section of this template, depending on what type of practice you currently run. So in terms of the 3 sections of this template, you've got a section on pre-treatment. So this section very much looks at those osteopaths that perhaps have been offering a telephone or video consultation service prior to face-to-face appointment during the pandemic. So it looks at things like have they received a telephone or video consultation, and how did they find that in terms of key aspects. So being felt that their cares and concerns were being demonstrated, involving them in the decision about their care, for example, and things like that. So that's about pre-treatment. The second section looks at the face-to-face appointment, so how osteopaths experienced that during the pandemic. So things like how long did they have to wait for their face-to-face appointment with you? Did they have any concerns about receiving osteopathic treatment as a result of COVID? And if they did, what were their main concerns? And if they've been to an appointment, how did they feel about receiving osteopathic treatment during the pandemic? So that you get a flavour for patients' experience of that face-to-face appointment as a result of COVID-19. So that's the second section. And the very final section of that template looks at aftercare and self-help for the patient. So after treatment, did they get the support they needed in relation to things like being able to take control and improve their health for themselves, making a plan of action with them, and also around whether the care that they've received has encouraged them to manage their condition more independently, for example. So you can see how you could potentially mix and match those sections, or just run with one of those sections from the COVID-19 template if that's something that appeals to you. So that's one possibility. The second template is generated from, as I say, the National Voices report, and basically they developed this on the basis as a result of the pandemic, and developed 8 I statements, and you can see that this infographic here that they developed as a result of that report. And basically what we have done here is, with the permission of National Voices, is translate those 8 statements into a patient feedback template that you can use. So you can see that those 8 statements have been turned into a Likert scale question, so from very unsatisfied to very satisfied. So some of the statements include things like I was listened to, and what I said was acted upon. So it's how the patient feels in relation to that item. How do they feel about I was able to make decisions that were respected and my rights were protected, for example. Or I know what to expect and that I'm safe when I have treatment and care. I know how to talk to my osteopath or team in charge of my care when I need to, and things like that. So that might be a potential option for some of you to run with as well. And if you wanted to read more information about where those statements are generated from, there's a link in the PowerPoint about that particular report as well. So that's another option in terms of a patient feedback template that you could run with. We then, if you don't want your template to focus on COVID and the impact of COVID on osteopathic practice, you might want one of our more generic templates. So there are 3 options here. We've got the care measure template, the GOsC template, and the NCOR template. So I'm going to take you through those so you can have a look at those. So the care measure template has 10 statements that are basically rated on a scale of poor to excellent. And the statements are, how good was the practitioner at the following? So, for example, how good were you at making them feel at ease? How good were you at letting the patient tell their own story? How good was the practitioner at really listening to them? How good were they were you at being interested in the patient as a whole person? How good did the patient think the osteopath was about fully understanding their concerns? How good was the practitioner in showing care and compassion, being positive, explaining things clearly to the patient, helping the patient take control, and making a plan of action with the patient? So you can see there's just 10 statements there on a scale of poor to excellent that you could potentially use. We also have some supplementary resources around the care measure about its origin, where it comes from. Some of you may have seen the care measure. It's quite often used in GP surgeries to collect patient feedback. You may have seen it in that scenario. So you might want to have a look at those additional resources as well in relation to the origin of the care measure. It also comes in a more accessible version. So if you think it would be more appropriate for your client base to have a more graphic images that they just circle, for example, you might think that the accessible care measure template might be more suitable. So just to give you an idea of what that looks like, you've got a picture on the screen, so much more visual, more graphics to it. In terms of responses. So that just gives you an idea of the statements are exactly the same as the one that I just showed you, but it's just got more images on it. So that might be an option. The third template to have a look at is the GOsC template that we designed as part of the CPD scheme, which is a bit of a combination of closed questions on a 3-scale rating, so not very well to very well, and some additional open questions. So this template might be something that you want to use, particularly if you want to get some qualitative written comments from your patient, as well as some tick box questions. So on this template, we have things like, how thoroughly did the osteopath ask you about why they had attended? Did you feel the osteopath listened to what you had to say? How well did the osteopath put you at ease during the physical assessment and examination? How well did the osteopath explain your problem to you? How well did the osteopath engage you in the consultation? Did you feel the osteopath demonstrated concern for your welfare? So those are all close questions, from not very well, fairly well to very well. And then you've got 3 open questions on this template. So what did you like about the osteopathy appointment, and what could have made that appointment better? So you get some qualitative comments there, and then they've got a comments box if they've got anything else that they want to add that isn't featured in the template. So again, this might be something that you might want to use and run with if you want a combination of open and closed questions. So that's that template. And the final template that we have, this is an NCOR template, which, instead of being on a Likert scale, many of the questions are just a simple yes, no answer. So this has things like, where were the symptoms that caused you to consult an osteopath? How long have you had those symptoms? And then it goes into a series of yes, no questions. So things like, were you always seen promptly for your sessions? Did you expect the treatment would remove your pain immediately? Yes, no. Did the osteopath listen to what you had to say? Yes, no. Did you have confidence that the osteopath knew what he or she was doing? Yes, no. And did you expect to have to do exercises in addition to your treatment? Yeah, yes, no. And the list goes on. So there's quite a few yes, no answers, and then a simple any other comments box at the end. So again, if you want to collect a more sort of perhaps a straightforward yes, no type survey, this might be the option to go for you. So you can see you've got a whole host of different templates that you could use. There's no reason why, if you like certain elements of one and elements of another, that you could mix and match the templates to suit the needs of your practice. We're just trying to make it a little bit more easier so that you've got some templates to run with if you want to. or these templates might give you some ideas to design a complete template from scratch, and that's okay as well. So, you know, bear in mind, just think what would suit your practice best, really. We're just offering some examples that you can run with if you want to. So those are the templates. So I'm going to go to our third and final poll, which asks which patient feedback template do you think you're going to use. So we've got the options. So the first one was the impact of the COVID template. National Voices template was the second one. The care measure template was the third. The fourth was the GOsC template, and the last one we looked at was the NCOR template. So if you're pretty sure which template you're going to use, if you could complete the poll, that would be great. And as I say, what we'll do is we'll return to the poll results towards the end so that you can see where you are in relation to the rest of the group that we have here today. I'm just going to give it a few moments for people to respond to the poll. Right, the poll has now closed, so I'm just going to move the PowerPoint presentation on. And as I said earlier in the webinar, that some of you may decide that you want to collect outcome-based data. And the best way for you to do this is through the NCOR patient-reported outcome measures. So what I'm going to attempt to do is play a short video, which is about 2 minutes long, to give you some basic information about the patient-reported outcome measures, and see if that might be a potential patient feedback mechanism for some of you that are on the webinar today.
Patient-reported outcome measures, or PROMs, are questionnaires that can help you get patient feedback. The PROM system for osteopaths was developed by the National Council for Osteopathic Research, NCOR, who analyse the feedback on your behalf. So it's an easy way to see how patients are responding to your treatment. PROMs can be used by all osteopaths. First, register with NCOR. They will provide you with your practitioner code, a poster, and patient information sheets for your practice. Next, invite patients, either new patients or returning patients with new symptoms, to complete an online questionnaire shortly before their treatment. They will be asked questions about their symptoms and general health. Patients are then sent a simple 5-minute questionnaire 1 week and 6 weeks after their treatment. They will be asked about their satisfaction and experience of osteopathic care and whether treatment has improved their symptoms. NCOR analyses the information collected from patients and provides you with a summary report that allows you to compare your feedback to national data. The report is confidential and is not shared with anyone else. Getting patient feedback allows you to reflect on what you are doing well and how you might enhance your practice to benefit patients. It can help you to meet the objective activity requirement of the General Osteopathic Council's CPD scheme. By taking part, you are also contributing to the collective evidence base for osteopathy and giving your patients a voice. To register or find out more, visit ncor.org.uk/practitioners/patient-reported-outcomes.
Yeah, so as I was saying, some of you might choose this as an option, and as you've seen in the video, it will give you the ability to compare your own data with national data through the report that NCOR will supply you in relation to your own data set that you collect. So you'll be able to watch the video again if people want to have a look, if you're still unsure as well, because you'll get the PowerPoint pack and you'll be able to run it from there. So that's another potential option for people as well, as patient feedback. So other things that you need to think about once you've decided, you know, which template or which option you're going to go with, is thinking about your sample selection, who you distribute your questions to and why. So when we talk about sample selection, we're talking about who that will be. So for some of you, you might decide to just do your survey with new patients. Others might decide to do it just with returning patients, or you might want to do it with both new and returning patients. You also need to think about the time frame that you're going to collect your patient feedback data from. So for example, you might decide that you might carry out your patient feedback for a couple of months, for example, maybe 8 weeks. So you need to have a defined sort of start and end date for collecting it. So you need to give that some thought. And also think about the Equality Act in terms of, how can you ensure that as many of your patients can participate as possible. You're in the best place to know your type of client base and what's going to work best for them. So think about that in relation to the Equality Act, and whether you need to offer any reasonable range, in terms of adjustments for patients to be able to complete it. Maybe an online survey won't suit everyone. So for some of you, maybe you will do a combination of online and hard copy, for example. So just thinking about some of those things in terms of your sample. The other thing that I mentioned earlier is to think about who else is going to be involved in getting you started with your patient feedback. So thinking about planning, who else needs to be involved in undertaking that. So if you've got colleagues or associates that you work with, do you want to draw them into this process? Do you want them to collect patient feedback survey responses as well as yourself, for example? So you might want to draw them into what you're doing. How you're going to communicate what you're doing to your patients. So we're going to have a look at the patient information sheet and what that might entail in a second. You might also, for those of you that have got a receptionist, you might want to bring them into the process. Perhaps they're the person that helps distribute those patient feedback surveys to your patients after their treatment, for example. Or you might just simply want a box in reception where your patients can pop them into the box after they've completed them. Then you've got no way of knowing who it is that's put those responses in the box. So it does help with making sure your survey is anonymous. Also thinking about multidisciplinary practice, maybe you work with other allied health professionals at your practice, and maybe you want to draw them into collecting patient feedback with you. So that's a possibility. Or also in the planning, if you're thinking about doing an online survey, obviously you need to factor in some design time of either transferring one of the templates onto the online platform or designing your own template that you're going to send out electronically. So it's just giving yourself the planning needs that you need to think about in terms of setting everything up, really. So I've talked a little bit about a patient information sheet. So what am I talking about when I refer to that? Basically, a patient information sheet is simply almost a cover sheet of your hard copy survey, or if you're going to do an online survey, then it might be the text that you put in the email that also has the link to the survey as well. So what should that patient information sheet or text cover? Why you're collecting patient feedback, so giving patients details about why you're doing what you're doing, telling the patient that their views are anonymous and confidential, how the patient's feedback will be used and reported within the clinical setting, what will be the outcomes of the feedback. Maybe you're going to report to patients how the results have been, what you found out essentially. Who do they contact if there are any concerns or worries? So if a patient wants to withdraw from the process, how do they do that? How do they contact you, for example? Information about data protection, so just a standard statement around data protection in your practice, and highlighting that their participation is voluntary, so they can withdraw from the process at any time if they wish to. So these are the sorts of things that your patient information sheet should cover. Now, we have developed a patient information sheet that you could potentially use the text that's there and just adapt it for your own purposes and your own practice. So just drawing your attention to that. So just give some basic information of why you're doing collecting feedback from patients, what you're going to do with the responses, how long it's going to take them to complete, who they can contact for further information, and a data protection statement. So you might want to just run with this text, or you might want to tweak it a little bit. So again, we're trying to make it as user friendly as possible. So this is your patient information sheet that will accompany your survey. And then there's some further sort of information that you can follow up around data protection and implications, so helping you with that statement. So you might want to look at these outside this session in relation to data protection, just to make sure you've covered everything that you've got there. And just other resources that you might want, sort of reading resources that you might want to look at in relation to patient feedback. The Picker Institute has some top 6 tips, which is quite helpful. I think, we've looked at today how you can kind of set clear goals and having a clear aim for your patient feedback survey, how to identify relevant stakeholders. So who are you going to involve? Is it going to be new, returning, or a combination of new and returning patients? Deciding who you want to gather feedback from is in relation to that, and who helps you do that in relation to whether you've got other colleagues that you work with, associates or allied health professionals. Have you got the adequate resources? So with a hard copy survey, minimal resources are needed. With the online, you might need some more sort of technical skills in relation to getting that up online. So thinking about the resources you have to do that, choosing the most appropriate method that suits your practice, and considering how you will act upon that feedback gathered, and that includes the analysis. And that very final top tip is we will look at in much more detail in that second session in May. So just to give you some further resources really, and reading material if people want to look at that. In terms of thinking about how you're going to record this for a CPD activity and ensure that you have everything that you need documented for your CPD record folder, we have developed a patient feedback analysis template for you to be able to do that. So after this session, potentially, you should be able to fill out the 2 boxes in this analysis template, the aims and the method, and then the subsequent boxes, so the remaining 4, which are results, areas of strength, areas of development, conclusions, action plan and next steps. You'll be able to complete those 4 boxes after our second session in May. So you can see how you can start to build and record what you've done. And to help you with that template, we do also have a completed example. So if we take the 2 boxes that you could potentially fill out after this session, the aims box looks at, what this hypothetical osteopath that's completed this template out looks at why they want to do what they want to do and the aims of doing it. So for example, they've written here, I'm interested to understand how patients feel about their treatment and their experience of treatment with me. I have never provided my patients with the opportunity to feedback anonymously before, and I'm interested to understand whether I can improve their experience with me. So that was this osteopath's aims for doing patient feedback. And how they went about their method was they gave out their questionnaire to every patient seen from a set period, so from the 7th to the 21st of November, and they asked them to complete it and put it in a box that was in reception. But they also offered an emailable questionnaire to patients and asked them to email it back or post it back to them using a stamped addressed envelope that was enclosed. So you can see that was the method that this particular osteopath had adopted. So you can see how however you choose to do your patient feedback, you can adapt what you put in those 2 boxes. So essentially those 2 boxes you could complete after the session today. We won't look at the results section and the subsequent sections, because those are what we're going to look at in the second section, second webinar. So we'll leave those for the next session. So in terms of next steps, so what should you do after this session? You need to think about and consider what questions and template you're going to administer. Some of you may have already decided that, and we'll have a look at the polls in a second. Prepare your patient information sheet. So, you've got some text to work with. You might just want to tweak it and adapt it. So make sure you've got that to accompany your survey. prepare your method of administration. So, involving other people that you need to, maybe having a box in reception, etc. Those sorts of things. Putting all those planning elements that we looked at in place, and then physically distributing your questions to your patients, either via physical hard copy or via an email link to an online version. And as I said, our next session will examine how you could analyze that data. So, what's the data that's come back in, what do you do with it, and how could you show what can you do with it, and how can it enhance your practice? And just to kind of highlight that you need to register for the next session that's on the 27th of May. So in the follow-up email that you'll receive with all of the materials that we've looked at today, there will be a link for you to register your place on that webinar. So just encourage people to do that if they can. And just to I'm just going to highlight a couple of other things that you're going to receive, and then we're going to have a look at the polls and any of the questions that have been posted during the session. So just to highlight that in the handouts pane of the control panel, as I said earlier, there is a downloadable version of the patient feedback workbook and the slides that have been on screen today. So if people want to download those now, they can. Alternatively, they will be in the follow-up email, so you'll also get a copy that way as well. We will also, in that follow-up email, will contain a feedback survey link to share your experiences of the webinar today. So I'd encourage people, if they can, to complete the feedback survey about the webinar. That would be really helpful to us. And we will also send an email with the templates that are discussed. So those 5 templates that we looked at, that will be in the follow-up email as well. Okay, so you'll get everything that you need. So I'm now going to hopefully be joined by Rachel as well, and we're going to have a look at the poll results and any questions that people have posted during the session.
Sure, that's great, Stacey. Thanks very much. Hi everybody. We've had actually quite high levels of participation in the polls, and the first one was have you undertaken an objective activity? And so 33% of those who participated said yes, and 68% said no, they haven't. So hopefully after these 2 sessions they feel more comfortable and they'll move to the yes section. Then the method of seeking patient feedback. The majority, I think they're going to do a hard copy version. 23% are considering online, and 38% are not yet decided. And then lastly, the template. Interestingly, the most popular template seems to be the care measure. The second most popular is the GOsC template that we have produced. And there are also quite a bit of interest in the COVID-19 one, 18%, 18% for the NCOR template, and 8% for the national voices. So I'll share that in the follow-up email. And in terms of questions, Stacey, the vast majority have actually centered on what is a good response rate.
Okay. We was expecting that one. So that's fine. Yeah, I would, for a good response rate, for what you want it for, to be able to enhance, to identify key areas that you can enhance your practice for, anything sort of between sort of 30 responses would be enough to give you enough to kind of work with. So a minimum of 30, I think would be best. And don't forget, those of you that are going to go for an online survey and might use SurveyMonkey for a free account, the maximum you can collect on the free account is 40, and so you don't want to be collecting over 40 responses, because otherwise you'll be on a paid account. So that's something to bear in mind as well. So if you aim for the 30 mark, that will be fine.
Okay, Stacey, thanks very much. A specific question here from an osteopath who has asked, can they base this objective activity on the views of a child patient and those of their mother, or do they need to have more participants? So I think this is a child and their, yes, I believe so, yes, as I understand.
Yeah, so potentially you could have a look at the slides that we looked at under other methods, and you might want to think about potentially perhaps recording verbal feedback. That might be an option if it's just a child and a guardian or parent. So you might want to think about that, but also think about you know, whether they'd be happy to do that, and sort of in relation to sort of data protection and so forth. So think about that in relation to that. But you could potentially have it as a sort of case study sort of example. We wanted to talk about that in a little bit more detail. Then obviously you've got the email address, so you can contact either myself or Rachel, and we could talk that through a bit further. But it's certainly a possibility, yes, as an other option.
Okay, interesting. Then someone has flagged, I think perhaps they're interested in SurveyMonkey, but then mentioned that there's perhaps a GDPR concern. Is it okay to use SurveyMonkey as long as you give a statement about how the data will be used and stored?
Yeah, absolutely. In that patient information sheet, that there is a statement towards the end of our example around sort of data protection. So yes, as long as you kind of put that details in relation to your practice and how you're storing that data, it would be fine. I would just highlight that. Just think about if you're how you've obtained your patient's email addresses. So you might want to ask their permission if it's okay to send your survey out prior to kind of actually physically just sending a blank email out to all of your patients, if that makes sense. So it's asking permission prior to sending out your survey might be a sensible approach.
Okay, two more questions to Stacey. This one we actually haven't had before in any of our webinars. Does a COVID screening questionnaire count as patient feedback?
I'd have to see what's in your screening questionnaire. So if you'd like to send that to one of us or both of us for us to have a look. Also, you have to think about how the permissions that you've gained, because really that was for clinical purposes rather than sort of patient satisfaction or patient feedback. And have you actually said to your patients that that's the reason that you would be using it for those purposes? So yeah, there's some. I'd need to have a look at the actual screening survey to have a look, but I also need to we'd also need to know what you've told patients about that screening survey, you know, and what you do with it.
Okay, just to flag, we'll certainly follow up directly with the person that asked that question. As I said, just to flag that they ask about COVID symptoms, whether they've been contacted by track and trace, and ask about support bubbles. So my sense is it's not necessarily about the quality of their care, but more kind of COVID specific in that sense. So, but as I say, the osteopath who has submitted that question will follow up directly, okay? And that's it, Stacey. Those are the main one was about response rate. What's a good quality response rate?
Okay, that's great.
Yeah.
Okay,
and I will
lovely.
send a follow-up email to everybody with all the information that we've discussed. Okay, so watch out for that.
Okay, what I'll just do in the sort of last couple of minutes is just show you other resources that are in the slide pack, just to highlight those, so that people are aware, if that would be helpful, I think. So we've seen what you need to do next. Just to highlight that other useful resources, if those of you that haven't visited the CPD microsite yet, obviously there's the link there where we've got a lot of this material. Patient feedback specific resources. So you've got the workbook that's currently in the handout section at the moment, but you'll receive that in the follow-up email. We've looked at the patient feedback analysis template, which has a completed example, and there's the link there. There's the patient information sheet and that sort of suggested text that you can have a look at. Then you've got a list of all of the 5 templates that we've looked at and the direct links to those templates on the website, so you can access those. And that's a continuation of with the care measure. As I said, we've got some supplementary resources in relation to the care measure. So there's the ordinary care measure, there's the accessible version, so the more graphic version, and there's also a document about the care measure and its origin, where it comes from, you know, and what it's used in relation to allied health professionals. Other CPD scheme resources. So if people are thinking about planning, there's a section on there's a workbook on planning your CPD. Objective activity workbooks. We have workbooks not only in patient feedback, but case-based discussion and peer observation. So people might want to have a look at those. If people are thinking or a bit stuck on what to do for their communication and consent activity, there's a workbook relating to that. If you're struggling to think about how to capture your CPD and record it, there's a workbook on keeping CPD records and reflection. And then there is also a peer discussion review. We have a video, as I say, that similar to this, that takes you through the peer discussion review process. So for those of you that weren't at that session or haven't looked at that video yet, you might like to do that also. And I just want to say a big thank you to everyone for participating in today's webinar. I hope you found it useful and it's given you food for thought for how to put patient feedback into practice for each of your individual clinics. As I say, if you've got any questions that haven't been covered, please do contact either myself or Rachel, and our emails are on the screen if you want to follow up with anything. And we hope to see many of you at the second session, which is on the 27th of May. So please don't forget to register for that session. So thanks everybody.